Welcome back. If you have unintentional, uncontrollable movements, it could be a side effect of your medication. And if so, that means that you could have tardive dyskinesia or TD. It's associated with certain prescription medications used to treat mental health or gastrointestinal conditions and affects a broad range of people. My guest today is Dr. Cherian Karunapuzha, the medical director of the Meinders Center for Movement Disorders, and he has the signs and symptoms of TD, and we're going to talk about the impact that it has on patients and loved ones. Thank you so much for being here today.
Thank you, Audrey, for having me today. I think it's an extremely important topic because it's a very common disorder but extremely under-recognized. Tardive dyskinesia, think of it as an abnormal neurological condition which gradually brews in your brain, and it becomes persistent when people take long-term use of medications which they would use for mental health conditions like antipsychotic meds, or nausea medications as well can sometimes cause this. These movements can happen in multiple body parts, including their lips, their face, their eyelids, their tongue, their arms, fingers, legs, in any body part you can imagine. And it can look sometimes very mild, so mild that the patient themselves don't realize it, but everybody else does. Or sometimes so severe to the point that that particular body part is disabled by these movements. The sad news is that it is persistent, it's irreversible, it doesn't go away. But the good news is that there's extremely effective treatment options available to treat tardive dyskinesia.
So is TD caused by specific medications or a specific line of medications? And how would someone know to look out for these signs and symptoms?
So there's a specific line of medications, which especially in the field of psychiatry, that would be the antipsychotic medications, which we use for multiple reasons, not just psychosis. We use it for depression, we use it for bipolar, for agitation. It has a wide range of use because these are extremely effective medications. It's just that a small percentage of patients, roughly 7 to 30% of patients, can develop these abnormal movements during their lifetime of taking these sort of medications.
Well, the impact on patients and their loved ones is probably pretty profound if you're A, trying to figure out what's going on, and B, trying to manage the symptoms.
That is true. The impact can be in multiple levels. First off, physical, right? So it affects the ability to drive because your eyes are twitching all the time. You can't type or text properly because your fingers are twitching. You can't speak properly because your tongue is rolling and you're biting your tongue all the time. It can be socially very impactful, right? You're so self-aware of these movements, you become reclusive, you don't get out there. It can be mentally impactful because you've finally gotten your mental disorder under control. Now you're stuck with this new neurological disorder which has come about as a consequence of taking meds. Now you're stuck dealing with that, you're starting to get more depressed, more anxious. So it can affect you and impact you in so many ways. This is why it's so crucial to get this diagnosed early. And that's the major drawback. We're talking about 500,000 odd patients are estimated to have tardive dyskinesia in America, but a very, very small percentage of them have actually been given a diagnosis of TD.
Doctor, how is TD diagnosed?
It's actually a very simple diagnosis. It requires a physical exam by the healthcare provider. So if you're worried or is suspicious that you may have these movements, just address this first with your healthcare provider, because all they have to do is take a look at you, and within about a minute to two, these movements come about. They're so stereotypical to this diagnosis that it's a very simple catch. But the hard part is getting there, right? So the under-recognition of tardive dyskinesia is so much so that 500,000 odd patients that we estimated, a large majority of them don't have a formal diagnosis of TD.
Well, I'm curious, what are some of the other factors involved other than just the medications?
There are certain risk factors for people taking such medications. And some of the risk factors which we've come to understand is if you're going to be on these kind of medications and you are older, you are postmenopausal, you have an active substance abuse, if you have a diagnosis of certain psychiatric conditions like mood disorders, these all put you at an increased risk for developing tardive dyskinesia. But first and foremost, the major risk factor is the potency of the medication that is being used. Certain antipsychotics are extremely strong and they're needed for effective control of the underlying psychiatric issue, but they also come with an increased baggage of developing tardive dyskinesia.
Interesting. So you have the medication to take care of one issue, and you might perhaps get another one. I mean, that's kind of crazy. So for every action, there's a reaction?
If I might just clarify just a little bit, these psychiatric medicines do a great job in controlling your underlying mental issues. So my suggestion is not to stop those medications or not try those, because that's what's needed to keep your baseline psychiatric issue under control. It's just that our science has only advanced to the point where we can reduce the potential onset of TD with the newer generation forms of these antipsychotic meds, but we can't make it go away completely.
Thank you for the clarification. I appreciate that. So what are the treatment options for TD?
There's multiple FDA-approved treatments and other treatment strategies to effectively control TD. So the big issue is not treatment, because once you get to the treatment stage, we have multiple options available. Problem is actually getting there. So that lack of awareness is really what we need to focus on today.
And if someone thinks that they might have TD and they're taking one of those medications, I guess the first thing they need to do is talk to their doctor.
That is correct. And if you are given a diagnosis of TD, or if you're really worried about TD, there are excellent resources available online as well, including a website called tardiveimpact.com, where you can learn way more about this disease.
Dr. Cherian Karunapuzha, the medical director for the Meinders Center for Movement Disorders, has been my guest. We've been talking about TD and its impact on patients and loved ones. I always say informed's empowered. If you don't know, you can't ask. But always, I like to remind you to check with your doctor and your healthcare provider. Thank you so much for joining me, doctor.
It's been a pleasure. Thank you.
And I'll be right back after this.